What are 3 things that coder must master? 1. Anatomy. 2. Medical terminology. 3. Must be detail-oriented. Medical coders assign a code to what? 1. Each diagnosis. 2. Service procedure. 3. Supply using the classification system when applicable. The classification system determines what? The amount healthcare providers will be reimbursed if the patient is covered by Medicare, Medicaid, or other insurance programs using the system. A coder must evaluate the medical record for 1. Completeness and accuracy. 2. Communicate regularly with physicians and oath healthcare professional to clarify DX or obtain additional PT info. Technicians who specialize in coding inpatient hospital services are referred as 1. Health information coders. 2. Medical record coders. 3. Coder abstractors. 4. Coding specialist. What is MSDRGs and what is it? 1. Medicare severity diagnosis related groups. 2. Determines the amount the hospital will be reimbursed if the PT is covered by Medicare or other insurance programs. What is EHR, electronic health record? Skill coders may become consultants, educators, or medical auditors. What is the difference between hospital and physician services? 1. Outpatient coding, learning CPT, HCPCS, Level 2, ICD 9 cm codes, Volume 1 and 2. 2. Inpatient coding, learning CPT, ICD 9 cm codes, Volumes 1, 2, 3 and MSDRGS. What is APC and who uses it? Ambulatory payment classification, outpatient facility coders, physician services. What is the coder role in a physician's office? Extremely important to proper reimbursement and the livelihood of the physician. What is a physician degree of education? 4 years of college, 4 years of medical school plus 3 to 5 years of residency. What is a mid-level providers and who? 1. Mid-level providers are known as physician extender. 2. Physician assistants and nurse practitioners. What are the requirements for a PA and what? 1. 26½ month to complete. 2. License to practice medicine with physician supervision. NP must have a master degree in nursing. How many payers in the most simplest form? 2. Private insurance plans and government insurance plans. Commercial carriers are considered what? Private payers that offer both group and individual plans. Private payers' contracts may vary but may include hospitalization, basic and major medical coverage. What is the most significant government insurer? Medicare. What is Medicare? Federal health insurance program administered by the Center for Medicare and Medicaid Services. What is CMS and what does it provide? Center for Medicare and Medicaid Services provides coverage for people over the age of 65, blind or disabled individuals, people with end-stage renal disease. CMS regulations often serves as blank word encoding requirement for Medicare and non-Medicare payers alike. List. What are the parts of Medicare? Medicare A, Medicare B, Medicare C, Medicare D. What is Medicare Part A? Covers inpatient hospital care as well as care provided in skilled nursing facilities, hospice care, and home health care. What is Medicare Part B? Covered medically necessary doctor's services, outpatient care, other medical services including some preventive service not covered under Medicare Part A. Medicare Part B is considered what? An optional benefit for which the patient must pay a premium and which generally requires a yearly copay. Where is Medicare Part B usually used? Physician offices. What is Medicare Part C? Combines the benefits of Medicare Part A, Part B, and sometimes Part D. What is Medicare Part C, also called Medicare Advantage? What is PPO, Preferred Provider Organizations? What is HMO, Health Maintenance Organizations? Which plan covers PPO and HMO? Medicare Part C. What is the CMS-HCC, Center for Medicare and Medicaid Services Hierarchical Condition Category? What does the CMS-HCC provide? Risk adjustment model provides adjusted payment based on a patient's disease and demographic factors. If a coder does not include all pertinent diagnoses and comorbidities, the provider may lose out on what? Additional reimbursement for which he/she is entitled. What is Medicare Part D? Prescription drug coverage program available to all Medicare beneficiaries. Private companies approved by Medicare provide the coverage. What is Medicaid? A health insurance assistance program for some low-income people sponsored by federal and state governments. Medicaid administered on a state-by-state basis and coverage varies although each of the state programs adheres to certain federal guidelines. When is a physician considered a participating physician? When contracted with the insurance carrier, whether that be a private insurance company or a governmental. Participating providers. Part providers are required to accept the allowed payment amount determined by the insurance carrier as the fee for payment and follow all other guidelines stipulated by the contract. The difference between the physician's fee and the insurance carrier's allowed amount is adjusted by the participating provider. Non-participating providers are 1. Providers not contracted with the insurance carriers. 2. Not required to make the adjustment. What is limiting charge? Limits set on what can be charged for each CPT code, no matter if the physician is par or non-par. What is a medical record? Documentation is the recording of pertinent facts and observation about an individual's health history, including past and present illness, tests, treatments, and outcomes. Medical record chronologically documents patient care to assist in continuity of care between providers, facilitate claims review and payment. Can a medical record serve as legal document? Yes. All services provided to a patient is supported and documented in the medical record. What is the coders required to with the medical records? To read and understand the documentation in the medical record in order to accurately code the services rendered. What are some different types of services documented in medical record? Evaluation and management operative reports, X-rays. Evaluation and management services are provided in what standard format? SOAP. What is SOAP? S subjective, O objective, A assessment, P plan. What is the definition of S of SOAP? Subjective, the patient's statement about his or her health, including symptoms. What is the definition of O of SOAP? Objective, the provider assesses and documents the patient's illness using observation, palpation, auscultation and percussion. Test and other services performed may be documented here as well. What is the definition of A of SOAP? Assessment, evaluation and conclusion made by the provider. This is usually where the diagnosis for the services are found. What is the definition of P of SOAP? Plan course of action. Here, the provider will list A next steps for the patient, whether it is ordering additional tests or taking over-the-counter medication. What is an operative report? A document the detail of a procedure performed on a patient. What will most operative notes have? Header and body. What are some of things that operative header note might include? 1. Date and time of procedure. 2. Name of surgeon, co-surgeon, assistant surgeon. 3. Type of anesthesia and anesthesiology provider name. 4. Pre-operative and post-operative diagnoses. 5. Procedures performed. 6. Complications. What are some of things that operative body note might include? 1. Indication for surgery. 2. Details of the procedure. 3. Findings. What is the approximate percentage of an operative report contains words less important to a coder? 20%. What is a task for a coder with an operative report? To break down the information and apply the correct code. What are the 5 most important coding tips for operative reports for a coders? 1. Diagnosis code reporting. 2. Start with the procedures listed. 3. Look for keywords. 4. Highlight unfamiliar words. 5. Read the body. What does the first coding tip mean for the operative report for a coder? Diagnosis code reporting. Use the post-operative diagnosis for coding unless there are further defined diagnoses or additional diagnoses found in the body or finding of the operative report. What does the second coding tip mean for the operative report for a coder? What does the third coding tip mean for the operative report for a coder? Look for keywords. Keywords may include locations and anatomical structures involved, surgical approach, procedure method, procedure type, size and number, and the surgical instruments used during the procedure. What does the fourth coding tip mean for the operative report for a coder? Highlight unfamiliar words. Words you are not familiar with should be highlighted and researched for understanding. What does the fifth coding tip mean for the operative report for a coder? Ready the body. All procedure reported should be documented with the body of the report. The body may indicate a procedure was abandoned or complicated, possibly indicating the need for a different procedure code or reporting of a modifier. What is medical necessity relates to whether a procedure or service is considered appropriate in a given circumstance. Generally, what a medically necessary service is. The least radical service procedure that allows for effective treatment of the patient's complaint or condition. Under what regulations is medically necessity found? Under Title 18/1862 of the Social Security Act. What is the National Coverage Determinations Manual? Describes whether specific medical items, services, treatment procedures or technologies can be paid under Medicare. What is the difference between covered and non-covered items? 1. Covered items, services and procedures are covered only when linked to designated approved diagnosis. 2. Non-covered items are deemed not reasonable or necessary. Medicare and many insurance plans may deny payment for a service that is not reasonable or necessary according to the Medicare reimbursement rules. What is NCD and what does it do? 1. National Coverage Determinations. 2. Explains when Medicare will pay for items or services. What is LCD and what is it? 1. Local Coverage Determinations. 2. MEC is responsible for interpreting national policies into regional policies. The LCDs further define what codes are needs and when an item or service will be coded. LCD have jurisdiction only with their regional area. What is MEC? Medical Administrative Contractor. If a NCD does not exist, what are CMS guidelines? How often do practices should check policies to maintain compliance? Quarterly. What does ABN stand for? Advance Beneficiary Notice of Non-Coverage or Advance Beneficiary Notice. What is ABN? A standardized form that explains to the patient why Medicare may deny the particular service or procedure. What does ABN protect? The provider's financial interest by creating a paper trail that CMS requires before a provider can bill the patient for payment if Medicare denies coverage for the stated service or procedure. What must the provider complete? 1. Complete one-page form in full. 2. Giving the patient an explanation as to why Medicare is likely to refuse coverage for proposed procedure or service. What are some of the common reasons why Medicare may deny a procedure and service? 1. Medicare does not pay for the procedure service for the patient's condition. 2. Medicare does not pay for the procedure service as frequently as proposed. 3. Medicare does not pay for experimental procedure services. What must the provider present to the patient on the ABN for a proposed procedure or service? Cost estimate. What does CMS instructions stipulate on cost estimate? Notifiers must make a good faith effort to insert a reasonable estimate. The estimate should be within $100 or 25% of the actual costs, whichever is graded. CMS rules require the provider to present the ABN to patient when far enough in advance that the beneficiary or representative have time to consider the options and make an informed choice. What must be done before the patient signs the ABN? 1. ABN must be verbally resolved with beneficiary or his/her representative. 2. Any questions raised during that review must be answered. After the ABN is signed, what are choices the patient has? What must go to the patient and to the provider? 1. Copy of completed side form must be given to beneficiary or representative. 2. The provider must retain the original notice on file. What action can the provider take if the patient refuses to sign the ABN? If the patient still requests the procedures and services but refuses to sign a properly presented ABN, the provider should document the patient's refusal. The provider and a witness should then sign the form. When is an ABN never required and why? 1. Emergency and urgent care situation. 2. CMS prohibits giving an ABN to a patient who is under duress, including patients who need emergency department service before stabilization. What is Hipaa? Health Insurance Portability and Accountability Act of 1996. How many acts are under Hipaa? 5. What is the important title concerning the position of a medical coder? Title II: Preventing Healthcare Fraud and Abuse, Administrative Simplification, Medical Liability Reform. What is Title II of Hipaa known as? Administration Simplification. Administration simplification speaks to what? The increasing use of technology in the healthcare industry. Administration simplification address the need for 1. National standards for electronic healthcare transaction and code sets. 2. National unique identifiers for providers, health plans and employers. 3. Privacy and security of health data. Who is under the covered entity? 1. Healthcare providers. 2. Health plans. 3. Healthcare clearinghouse. Who is under the healthcare providers covered entity? 1. Doctors. 2. Clinics. 3. Psychologists. 4. Nursing home. 5. Pharmacies. Who is under the health plan covered entity? 1. Health insurance companies. 2. HMO. 3. Company health plans. 4. Government programs that pay for health care, such as Medicare, Medicaid, and the military and veterans health care programs. The definition of a health plan in the Hipaa regulations excludes any policy, plan, or program that provides or pays for the cost of accepted benefits. What do accepted benefits include? What is included in the healthcare clearinghouse covered entity? Entities that process non-standard health information they receive from another entity into standard format or vice versa. Why is there a need for national standard for electronic healthcare transaction and code set? What transactions are used in national standard for electronic care transaction and code set? What are the code sets that within the transactions code sets have been designated for standard use? 1. HCPCS 2, CPT 3, CDT 4, ICD 9 cm 5, NDC. What is ACROM? HCPCS stand for Healthcare Common Procedure Coding System. What is ACROM? CPT stand for Current Procedural Terminology. What is ACROM? CDT stand for Common Dental Terminology. When will ICD 10 cm be effective? October 1, 2013. What does the ACROM NDC stand for? National Drug Codes. What does the ACROM NPI and who used it? 1. National Provider Identifier. 2. Identifier for providers required on the transactions. What does the ACROM EIN and who uses it? 1. Employer Identification Number. 2. Issued to employers by the Internal Revenue Services. Who enforces Hipaa Privacy Rule, OCR? What does the ACROM OCR stand for? Office of Civil Rights. What does the OCR do? Protects the privacy of individually identifiable health information. Hipaa Security Rule. Patient Safety Rule. What is the Hipaa Security Rule according to the OCR? Sets national standards for the security of electronic protected health information and the confidentiality provision of the Patient Safety Rule. What is the Patient Safety Rule according to the OCR? protects identifiable information being used to analyze patient safety event and improve patient safety. What does the acronym PHI stand for? Protected Health Information. What does acronym TPO stand for? Treatment, Payment and Healthcare Operations. When and who can a covered entity disclose health information to? What is the Hipaa minimum necessary requirement? Only the minimum necessary protected health information should be to satisfy a particular purpose. If the information is not required to satisfy a particular purpose, it must be withheld. Under the privacy rule M, the minimum necessary standards does not apply to the following. What does the acronym HITECH stand for? Health Information Technology for Economic and Clinical Health Act. What does the acronym IRAS stand for? American Recovery and Reinvestment Act of 2009. HITECH was enacted as part of what era? What was ARA and HITECH promote? The adoption and meaningful use of health information technology. Portions of HITECH strengthen Hipaa rules by addressing the privacy and security concerns associated with the electronic transmission of health information. HITECH has how many categories of violation? 4. What are the categories depending on the covered entity's level of culpability for releasing protected information and minimum and maximum penalties? HITECH lowers what for what constitutes a violation but provides what during which any violation not due to willful neglect may be corrected without a penalty. 1. Lowers the bar to 30-day window. HITECH allows patients to do what? 1. Request an audit trail showing all disclosures of their health information made through an electronic record. 2. Requires an individual to be notified if there is an unauthorized disclosure or use of his or her health information. What should all physicians' office and healthcare facilities should have an actively use compliance plan? What is a compliance plan? A written set of instructions outlining the process for coding and submitting accurate claims and what to do if mistakes are found. What are several benefits that a compliance plan can offer? 1. Faster, more accurate payment of claims. 2. Fewer billing mistakes. 3. Diminished chances of a payer audit. 4. Less chance of running afoul of self-referral and anti-kickback statutes. Increased accuracy of physician documentation in result of a compliance program actually may assist what? Enhancing patient care. What does the acronym OIG stand for? Office of Inspector General. What does the acronym HHS? Department of Health and Human Services. What is the OIG? A government agency tasked to protect the integrity of Department of Health and Human Services programs as well as the health and welfare of the beneficiaries of those programs. What was published in the Federal Register on October 5, 2000? The OIG Compliance Program for Individual and Small Group Physician Practice. What are the key actions of these programs? What month of each year does the OIG release a work plan outlining its priorities for the fiscal year ahead? October. Prefixes often indicate what? Location, time, number. Identify the following prefix of location: ecto, out, outside. Identify the following prefix of location: endo, in, within. Identify the following prefix of location: meso, middle. Identify the following prefix of location: dextro, right. Identify the following prefix of location: sinister o, left. Identify the following prefix of location: ab, away from. Identify the following prefix of location: ad, toward, near. Identify the following prefix of location: dia, through, complete. Identify the following prefix of location: per, through. Identify the following prefix of location: trans, through, across. Identify the following prefix of time: ante, before, forward. Identify the following prefix of time: pre, before, in front of. Identify the following prefix of time: pro, before, in front of. Identify the following prefix of time: post, after, behind. Identify the following prefix of number: mono, one, single. Identify the following prefix of number: bi, two, twice. Identify the following prefix of number: tri, three. Identify the following prefix of number: quadri, four. Identify the following prefix of number: poly, many, much. What does the term suffix mean and where does come from? 1. To fasten underneath. 2. Latin word subfigure. What are some of the common suffixes for diseases and meaning? 1. Itis, inflammation. 2. Oma, tumor. 3. Pathy, disease of. Identify the following suffix: gram, a record of data. Identify the following suffix: graph, instrument for recording data. Identify the following suffix: graphy, act of recording data. Identify the following suffix: meter, instrument of measuring. Identify the following suffix: scope, instrument for viewing or examining. Identify the following suffix: scopy, examination of. Identify the following suffix: synthesis, puncture, tap. Identify the following suffix: disease, binding, fusion. Identify the following suffix: ectomy, excision, surgical removal. Identify the following suffix: pexy, surgical fixation. Identify the following suffix: plasty, plastic repair, plastic surgery, reconstruction. Identify the following suffix: rraphy, surgical repair, suture. Identify the following suffix: stomy, surgical creation of an opening. Identify the following suffix: tome, instrument for incising. Identify the following suffix: tomy, incision, cutting. Identify the following suffix: trypsy, crushing. What is the standard body posture and what is it? 1. Anatomical position. 2. An upright, face-forward position with the arms by the side and palms facing forward. The feet are parallel and slightly apart. What does anterior or ventral mean? Toward the front of the body. What does posterior or dorsal mean? Toward the back of the body. What does medial mean? Towards the midline of the body. What does lateral mean? Toward the side of the body. What does proximal mean? Near to the point of attachment or to the given reference point. What does distal mean? Farther from the point of attachment or from a given reference point. What does superior mean? Above, toward the head. What does inferior mean? Below, toward the lower end of the spine. What does superficial? Closer to the surface of the body. What does deep? Closer to the center of the body. What does sagittal plane mean? Cuts through the midline of the body from the front to back and divides the body into right and left sections. What does frontal plane mean? Cuts at a right angle to the midline, cut from side to side and divides the body into front and back sections. What does transverse plane mean? Cuts horizontally through the body and separates the body into upper and lower sections. The structure of the human body falls into how many categories? 4. What are the categories of the human body? 1. Cells. 2. Tissues. 3. Organs. 4. Systems. What is a cell? A basic unit of all living things. What are 4 components of a cell and what do they do? 1. Cell membrane forms the boundary of the cell. 2. Cytoplasm make up the body of the cell. 3. Nucleus, a small, round structure in the center of the cell. 4. Chromosomes located in the nucleus of the cell. They contain genes determining hereditary characteristics. What are 4 types of tissue and what do they do? What are organs? 2 or more kinds of tissue together performing special body functions. What are systems? A group of organs working together to perform a complex body function. What is cytology? Study of cells including the formation, structure and function of cells. What does the acronym RNA mean and what does it do? 1. Ribonucleic acid 2. Contained within the nucleus is transcribed from DNA by enzymes and plays a crucial role in protein synthesis. What is a gene? Specific segment of base pairs in chromosomes, functional unit of heredity. What is mitosis? Cells divide and multiply to form 2 cells. How many body cavities does the body have? 5. What are the 5 types of body cavities and what is in the space? How many types of membranes are there in the human body? 5. What are 5 types of membranes in the human body? 1. Mucous membrane 2. Serous membrane 3. Synovial membrane 4. Meninges. What is the mucous membrane composed of? Epithelium overlaying a layer of connective tissue called lamina propria. What is the job of epithelium in mucous membranes? Involved in absorption and secretion. Where is mucous membrane lined? Line the interior walls of the organs and tubes opening to the outside the body. What is the serous membrane composed of? A layer of simple squamous epithelium overlaying a layer of loose connective tissue. What does the serous membrane support? Internal organs. What does the serous membrane compartmentalize? The large cavities to hinder spread of infection. What does the serous membrane line? Cavities including the thoracic cavity and internal organs. What is synovial membrane composed of? Connective tissue. What does synovial membrane line? Joint cavities. What does synovial membrane do? One secretes synovial fluid into the joint cavity to lubricates the ends of bones so they move freely. What is meninges composed of? 3 connective tissue membrane. Where are meninges found? With the dorsal cavity. What does the meninges do? Serve as a protective covering. What does the cutaneous membrane consist of? A thin outer layer of stratified squamous epithelium attached to a thicker underlying layer of connective tissue. What does the cutaneous membrane forms? The outer covering of the body. What is another for the cutaneous membrane? Skin. What is connective tissue? A number of different tissues with common feature. What does purpose of connective tissue? They support and connect tissue of the body. What are the 4 general group of connective tissue? 1. Connective tissue proper. 2. Cartilage. 3. Bone. 4. Blood. The largest organ system in the body is comprised of what 3 structures? 1. Skin. 2. Hair. 3. Nail. What is largest organ system called? Integumentary system. These structures work together to provide what functions within the body? 1. Protection from injury, fluid loss and microorganism. 2. Temperature regulation. 3. Fluid balance excretion. 4. Sensation. What 2 layers make up the human skin? 1. Dermis. 2. Epidermis. The epidermis is composed of what? 4 to 5 layers called stratum. The number of stratum varies based on what? Where the epidermis is located. Stratum lucidum layer is normally found only on what? 1. Palms of the hands. 2. Soles of the feet. What are the 5 strata of the epidermis? 1. Stratum corneum. 2. Stratum lucidum. 3. Stratum granulosum. 4. Stratum spinosum. 5. Stratum basale. What is stratum corneum composed of? The horny layer's outermost layer. What is stratum lucidum composed of? Clear layer. What is stratum granulosum composed of? Granular layer of cells. What are 2 types of granules? 1. Keratohyaline granules. 2. Lamellatid granules. What is stratum spinosum composed of? Composed of prickle cells. What is stratum basale composed of? Deepest of the 5 layers made of basal cells. Where is the dermis located? Under the epidermis. What are the 2 layers of strata of the dermis? 1. Stratum papillar. 2. Stratum reticular. What is stratum papillar composed of? Thin superficial layer interlocked with epidermis. What is stratum reticular composed of? Thick layer of dense irregular connective tissue. The dermis contains many important structures nourishing and innervating the skin. What are they? 1. Vessels carrying blood and lymph. 2. Nerves and nerve endings. 3. Glands. 4. Hair follicles. What lies underneath the dermis? Subcutaneous layer. What is another name for subcutaneous layer? Hypodermis. Subcutaneous layer is not considered a layer of skin. Subcutaneous tissue is mostly composed of fatty or adipose tissue plus some areolar tissue. What is areolar tissue? Loose connective tissue consisting of a meshwork of collagen, elastic tissue and reticular fibers. The hypodermis serves to 1. Protect the underlying structures. 2. Prevent loss of the body heat. 3. Anchor the skin to the underlying musculature. What is the fibrous connective tissue that is included in this layer? Superficial fascia. Define cutaneous, pertaining to the skin. Define dermatology, the study of the skin. Define dermatologist, physician specializing in diseases of the skin and subcutaneous tissue. Define decubitus, pressure ulcer bedsore. Define ecchymosis, condition in which blood seeps into the skin causing discoloration. Define hypodermic, pertaining to under the skin. Define intradermal, pertaining to within the skin. Define jaundice, yellowness of skin. Define melanin, pigment giving color to the skin. Define melanoma, pigmented tumor of the skin. Define pediculosis, infestation with lice. Define subcutaneous, pertaining to below the skin. Define tinea, ringworm, a fungal infection of the skin. By which week does a developing fetus has its lifetime supply of hair follicles? 22 weeks. On average, a human body have how many follicles? 5 million. Where is greatest concentration of follicles? Head. Hair on the scalp grows approximately how much per day and per year? 1.3 to 0.4 millimeters day. 2 at 6 inches per year. What are 2 structures of hair? 1 follicle. 2 shaft. The shaft is composed of keratin in what 3 layers? 1 medulla. 2 cortex. 3 cuticle. Pigment cells are in what layer of the shaft? Cortex. What layer give hair its characteristic color? Medulla. What is a fingernail made of? Keratin. What is the purpose of keratin on the fingernail? 1. Protective plate. 2. Counter force to the fingertip to increase sensory input of touch. Nails grow all the time but the rate of growth sloweth. 1 age. 2. Poor circulation. Fingernail grow at an approximate rate of 3 millimeters per month. Toenails grow what? More slowly. Toenails grow at approximate rate 1 millimeter per month. What are the 6 specific parts of the nail? 1 root. 2 nail bed. 3 nail plate. 4 eponychium. 5 perionicum. 6 hyponychium. The root lies beneath the skin behind the fingernail and extends several millimeters into the finger, is also known as germinal matrix. The root produces of what of the nail? Most of volume. What is the nail and the nail bed and its edges called? Lunula. What is another name for the nail bed? Sterile matrix. Where does nail bed extend to? The edge of the lunula to the hyponychium. What does the nail bed contain? 1. Blood vessels. 2. Nerves. 3. Melanocytes. Define alopecia. Loss of hair. Define follicles. Specialized structures required for hair growth. Define hair follicles. Sacs holding the root of hair fibers. Define hair papilla. Knob-like indentation at bottom of hair follicle containing the bloody supply to hair root. Define onchitis, inflammation of nail matrix. The musculoskeletal system is a system of muscles, joints, tendons, ligament. What does the musculoskeletal system provide? Movement, form, strength and protection. Bones are composed of what? Rigid connective tissue. Bones provide what functions? 1. Form the skeleton. 2. Provide the chief means of support for the body. 3. Provide the mechanism for motion. 4. Protect vital organs. 5. Serve as a production factory for blood cells. 6. Store calcium, phosphorus, and magnesium salts. What are the 7 classifications of bones? 1. Long. 2. Tubular. 3. Short. 4. Sesamoid. 5. Cuboidal. 6. Flat. 7. Irregular. Define the classification long of bones. Bones longer than they are wide and found in the limbs. The bones are named for their elongated shape, not their size. Define the classification tubular of bone, referred to as long bones. Define the classification short of bone, roughly cube-shaped bones. Define the classification sesamoid of bone, a short bone formed within tendons, cartilaginous in early life and osseous in adult. What is the largest sesamoid bone? Patella. Define the classification cuboidal of bone, referred to as short bones. Define the classification of flat of bone. Consists of a layer of spongy bone between 2 thin layers of compact bones. Cross-section is flat, not round. Flat bones have marrow but lack what? Bone marrow cavity. Define classification irregular of bone. Bones in the body not fitting into the above classifications mentioned. Vertebrae are considered what? Irregular bones. What is cartilage? A type of flexible connective tissue. True or false? Cartilage is non-vascular or has no blood vessels. True. Cartilage is made of a matrix of chondrocytes, collagen cells called proteoglycans depending on the type of cartilage. Joint and articulating surfaces provide what? A connection between 2 or more parts of skeleton. Joints are classified according to what? The type of connective tissue at the articulating surfaces. What are the 3 types of joints? 1. Fibrous. 2. Cartilaginous. 3. Synovial. What are the characteristics of synovial joints? 1. Articular cartilage that covers the bone ends. 2. Joint cavity lined with synovial membrane. 3. Joint capsule of fibrous connective tissue that surrounds and provides stability of the joint. 4. Accessory ligament that give reinforcement. The human skeleton is divided in which 2 parts? 1. Axial. 2. Appendicular. What does the axial skeleton consist of? Skull, hyoid, cervical spine, ribs, sternum, vertebrae, sacrum. What does the appendicular skeleton consist of? Shoulder girdle, pelvic girdle, extremities. Define closed fracture. Does not involve a break in the skin. Define compound fracture. Projects through the skin with a possibility of infection. Define comminuted fracture. Shatter affected part into bony fragments. Define transverse fracture. Breaks shaft of a bone across the longitudinal axis. Define green stick fracture. Only one side of the shaft is broken and other is bent, common in children. Define spiral fracture. Spread a long length of bone and produced by twisting stress. Define Cole's fracture. Occurs in rigid and affects the distal radius bone. Define compression fracture. Vertebra collapse due to trauma, tumor or osteoporosis. Define epiphyseal fracture. Occurs when matrix is calcifying and chondrocytes are dying, common in children. What are 3 types of muscles found in the body? 1. Skeletal muscle. 2. Cardiac muscle. 3. Smooth muscle. What is skeletal muscle? Also called striated muscle, it is attached to the skeleton by tendons. Contraction of skeletal muscle is under voluntary control. What is cardiac muscle? Also called heart muscle, it contains interlocking involuntary striated muscles as well as smooth muscle, which allow the electrical impulses to pass quickly across the muscle fibers. What is smooth muscle? Found in the walls of all the hollow organs of the body except the heart. Its contraction reduces the size of these structures. Movement generally is considered involuntary. Define ankylosis. Condition of stiffening of joint. Define arthralgia, pain in joint. Define arthritis, inflammation of joint. Define arthrodesis, surgical fixation of a joint. Define arthropathy, joint disease. Define bursitis, inflammation of bursa. Define carpal, pertaining to the wrist bones. Define chondral, pertaining to cartilage. Define chondralgia, pain around and in the cartilage. Define coccygeal, pertaining to coccyx. Define connective, tissue connecting or binding together. Define dactylic, pertaining to finger or toe. Define femoral, pertaining to femur or thigh bone. Define iliac, pertaining to the ilium. Define kyphosis, abnormal curvature of thoracic spine. Define lordosis, abnormal anterior curvature of spine, usually lumbar. Define metacarpal, bones of hand. Define osteoblast, bone-forming cell. Define osteocarcinoma, cancerous tumor of bone. Define osteochondritis, inflammation of bone and cartilage. Define osteopenia. Lower than average bone density can be a precursor to osteoporosis. Define osteoporosis, condition resulting in reduction of bone mass. Define osteopathy, suture of bone. Define patellar, pertaining to patella. Define phalangeal, bones of fingers and toes. Define scoliosis, lateral curvature of spine. Define sternotomy, surgical incision of sternum. Define tendinitis, inflammation of tendon. Coding is. Proper code assignment is determined by content of the medical record and by the unique rules that governs each code set. What are 3 things that coder must master? 1. Anatomy. 2. Medical terminology. 3. Must be detail-oriented. Medical coders assign a code to what? 1. Each diagnosis. 2. Service procedure. 3. Supply, using the classification system when applicable. The classification system determines what the amount healthcare providers will be reimbursed if the patient is covered by Medicare, Medicaid, or other insurance programs using the system. A coder must evaluate the medical record for 1. Completeness and accuracy, 2. Communicate regularly with physicians and oath healthcare professional to clarify DX or obtain additional PT info. Technicians who specialize in coding inpatient hospital services are referred as 1. Health information coders, 2. Medical record coders, 3. Coder abstractors, 4. Coding specialist. What is MSDRGs and what is it? 1. Medicare severity diagnosis related groups. 2. Determines the amount the hospital will be reimbursed if the PT is covered by Medicare or other insurance programs. What is EHR? Electronic Health Record. Skill coders may become consultants, educators, or medical auditors. What is the difference between hospital and physician services? 1. Outpatient coding, learning CPT, HCPCS, Level 2, ICD 9 cm codes Volume 1 and 2. 2. Inpatient coding, learning CPT, ICD 9 cm codes Volumes 1, 2, 3 and MSDRGS. What is APC and who uses it? Ambulatory Payment Classification, Outpatient Facility Coders, Physician Services. What is the coder role in a physician's office? Extremely important to proper reimbursement and the livelihood of the physician. What is a physician degree of education? 4 years of college, 4 years of medical school plus 3 to 5 years of residency.